Welcome to RSSDI TV 2020. I am Dr. Ruchi Shah, and on behalf of Wockhardt RSSDI TV 2020, I welcome you all. I am glad to have with us today renowned diabetologist from Gujarat, Dr. Parikshit Goswami sir. Sir is a consultant diabetologist and a metabolic physician, Ayush Diabetes Clinic, Himatnagar. Sir has a rich clinical experience in managing diabetes patients. Welcome, Dr. Parikshit Goswami sir, to the show.
Yeah.
So, sir, based on your recent talk in RSSDI 2020 on an interesting topic of what comes first in type 2 diabetes management about the basal insulin, we would like to know from you, what is the reason to start basal insulin as a first injectable when oral anti-diabetic drug therapy fails in a type 2 diabetes patient?
Yeah, thank you very much, Dr. Ruchi, for asking this important questions. Although my talk is for, or you can say against the GLP-1 receptor agonist, why one should choose injectable therapy in type 2 diabetes once the OED fail, and that is to be a first injectable therapy. So reason is that for most of the time, if you look at the Indian scenario, where most of the our type 2 diabetes patients taking more than 4 or 5 OHG, when the issue or when the question arises to start injectable therapy. There are certain reasons in Indian scenario, particularly where I and you practice. The first and foremost is the simplicity what basal insulin gives all of us, and it is utmost important for the patient because it is to be given once daily only, either at night or either before the breakfast. Second one is easy availability, and basal insulin, although you can say that we generally start with the premix insulin, but since long we have a lot of experience in starting the basal insulin in type 2 diabetes where OED fails. And if you compare the other injectable like GLP-1 receptor agonist, the cost is the biggest barrier. Even injectable therapy is the biggest barrier in our patient scenario. So GLP-1 receptor agonist, again, it's a big deal to initiate once the OED fails. And for that matter, the basal insulin is the first injectable therapy in type 2 diabetes when OED fails.
Thank you, sir. So, sir, how early insulin initiation helps in the course of type 2 diabetes?
So, from moving the first questions, how it really helps actually. So, in the spectrum of entire spectrum of the type 2 diabetes, where there is a hyperinsulinemia, then subsequently insulin resistance, and at any given point of the time during the course of type 2 diabetes, there will be insulin deficiency. So by that time, a lot of beta cell is lost in terms of function and mass. If we really want to save the beta cell, insulin is the first injectable for me. A lot of data set, but one data set I would like to highlight is for the UKPDS. I had shown again and again that if you initiate the early in the course of type 2 diabetes, insulin as injectable therapy, that saves a lot of beta cell.
So, sir, the last question, kindly share your opinion regarding the newer basal insulin like the Glargine U300 and the Degludec in the management of type 2 diabetes mellitus.
Okay. So again, the questions is always arise that to which basal insulin choose. And now with the newer second generation basal insulin, particularly Glargine U300 and the Degludec. So we must know and we must understand what is the difference between two, particularly a Glargine U100. And if someone is using the NPH, I use a lot of NPH. There is inherent issue once you use the NPH because if you want to really cover the basal part, then you need to give it twice a day. Similarly, the case with the Datimir. So, but now you will ask me that, doctor, what is the real difference between glargine and the glargine U300 and the dagludec? If you look the efficacy data, the data set are very similar. If you take the trials for the glargine U300 in comparison to glargine, and the data set again for dagludec versus glargine 100, the glycemic efficacy is a similar one. But now we are living in the era of time in range, where the glycemic variability is the most important part. And this newer second generation insulin gives an added advantage in terms of inter-day variability, intra-day variability, individual variability. Uh, that is added advantage. And in terms of overall and nocturnal hypoglycemia, these newer insulins are far, far superior that you know. And the last point, the patients who require emergency admission for hypoglycemia, that is called severe hypoglycemia incidence, also much, much lower in this newer second generation basal insulin, particularly glargine U300 and the dagludec.
Thank you so much, sir, for sharing your views on the basal insulin and type 2 diabetes management. So stay tuned to RSSDI TV 2020, brought to you by Wockhardt, for the more recent updates from RSSDI 2020. Thank you very much.
Thank you. Thank you very much.